Welcome to this concise guide on ulcerative colitis, where we will explore what the disease is, how it presents, and the modern strategies used to diagnose and manage it, all with the goal of helping patients and clinicians navigate this complex, chronic condition with clarity and compassion. In this chapter, we'll define ulcerative colitis in plain terms, a chronic inflammatory condition of the colon that causes continuous mucosal inflammation starting in the rectum and often extending upward, and we'll explain why understanding its pattern matters for treatment decisions. Ulcerative colitis is the most common form of inflammatory bowel disease, affecting large numbers of people and requiring lifelong management. Persistent inflammation damages the colon lining, prompting symptoms that range from mild discomfort to severe disease, and making prompt, effective therapy essential. This illustration shows how ulcerative colitis typically begins in the rectum and extends upward in a continuous fashion, which helps distinguish it from other conditions, like Crohn's disease, that tend to cause patchy inflammation. At its core, ulcerative colitis reflects an immune system misdirected at the colon, with genetic susceptibility, microbiome imbalances, and environmental triggers, all contributing to an ongoing inflammatory response that damages healthy tissue. Risk factors for ulcerative colitis include a peak onset in adolescence and early adulthood, with another, smaller peak later in life. Certain ethnic patterns suggesting genetic predisposition, and the curious observation that non-smokers and recent quitters can face higher UC risk than current smokers. Now we move into recognizing symptoms, where identifying key warning signs early can speed diagnosis and reduce complications by getting people the right care sooner. The hallmark symptoms of ulcerative colitis are often dramatic. Bloody diarrhea is common and alarming. Urgent and incomplete bowel movements occur. Abdominal cramping can be debilitating, and chronic inflammation often causes systemic effects like fatigue and weight loss. Ulcerative colitis is more than a gut disease. It can affect joints, skin, eyes, and the liver. So extraintestinal manifestations such as arthritis, painful skin nodules, eye inflammation, or primary sclerosing cholangitis require coordinated monitoring alongside bowel care. This patient perspective reminds us that living with ulcerative colitis means unpredictable flares, social and work challenges, and physical limitations. Yet with proper treatment and support, many people learn to manage symptoms and reclaim meaningful, active lives. Diagnosing ulcerative colitis is a stepwise process combining clinical assessment, laboratory tests, stool studies, imaging, and direct visualization, all used to confirm the diagnosis and exclude other causes of colitis. Diagnosis begins with a detailed medical history and symptom review, supported by blood tests that detect anemia and inflammation, and stool tests such as fecal calprotectin that indicate intestinal inflammation while ruling out infections. Endoscopy and biopsy are considered the diagnostic gold standard, allowing direct visual confirmation of continuous colonic inflammation, targeted tissue sampling to confirm mucosal disease, and shorter, flexible sigmoidoscopy options when appropriate. Imaging and severity assessment complement endoscopy, with abdominal X-rays spotting urgent complications like toxic megacolon, CT, or MRI, showing wall thickness and abscesses, and clinical scoring systems guiding whether disease is mild, moderate, or severe. This chapter introduces current treatment strategies from basic anti-inflammatory drugs up to advanced, targeted therapies, and explains how clinicians choose the right approach based on disease severity and patient needs. Medical treatments range from 5-ASA compounds for mild disease to corticosteroids for short-term flare control, immunomodulators that take months to work, and biologic agents that selectively block inflammatory pathways for moderate to severe cases. When medical therapy fails, surgery such as proctocolectomy can be curative by removing diseased colon, and reconstructive procedures like the J-pouch can restore bowel continuity. but decisions weigh potential risks against long-term quality of life gains. Personalized care follows a 4P approach, predicting which patients will respond to specific therapies, preventing complications through surveillance, tailoring treatment intensity to individual needs, and engaging patients as active participants in care. Chapter 5 turns to complications and long-term management, emphasizing that sustained surveillance and comprehensive care are essential to reduce serious risks and preserve function over a patient's lifetime. There are several serious risks to monitor closely, including an elevated colorectal cancer risk with long-standing disease, severe bleeding, and anemia from chronic blood loss, life-threatening toxic megacolon, and bowel perforation that demands emergency surgery. In children, ulcerative colitis can impair nutrient absorption and slow growth, so early nutritional support, vitamin and mineral supplementation, and close monitoring are critical to help kids reach normal developmental milestones. The psychological burden of ulcerative colitis is significant, with chronic fatigue undermining daily life and high rates of anxiety and depression. Access to counseling, support groups, and therapies can greatly improve coping and overall well-being. The journey to remission is rarely linear. It involves initial diagnosis, induction of remission with appropriate therapy, maintenance treatment to prevent flares, active monitoring for complications, and adapting care when relapses occur. Looking ahead, the future of ulcerative colitis care includes novel small molecules and targeted agents, microbiome-based therapies, advanced biomarkers to predict flares and treatment response, and digital tools that enable continuous symptom monitoring and telehealth support. Living well with ulcerative colitis starts with early diagnosis and personalized treatment, delivered by multidisciplinary teams, and supported by patient education and empowerment, so people can pursue fulfilling, active lives despite chronic disease.